All right. Good afternoon. It's me, Tim O'Connor, your Thursday host for A Free Solution. This is the show that I share with Larry Sharp and Kevin Wilson, and you guys can check out Kevin and I doing our stuff together for Fridays. It is January 20th, 2022. And so, guys, always the news about COVID is contentious and argumentative. And recently in New York State, and guys, I'm not going to spend the whole show on this. I just want you to, but I want to cover a subject that I think, I don't know, probably left a lot of people flabbergasted, probably surprised a lot of people, probably annoyed a lot of people. And I'm going to go right to a Wall Street Journal article. It's a Wall Street Journal opinion-based deal. But recently, you guys are probably aware because you probably heard it on the news. New York decided to have race-based preferential COVID treatments. And this is by John B. Judas and Rui Teixeira. And it's dated January 7th, 2022. And so I'm a little bit behind the curve on it, but I think it's worth discussing. And I'm going to take a couple of different angles on it that I want to, first of all, on its face, it sounds horrible, right? That New York State recently published guidelines for dispensing potentially life-saving monoclonal antibodies and oral antivirals like paxlovid to people suffering from mild to moderate symptoms of COVID-19. These treatments are in short supply, and you got to ask yourselves why these treatments are in short supply. But okay, they're in short supply. The government has its heavy hand on these things, and so these things are in short supply. To work our way down through the article, these guys are pretty upset about it. This is from, again, the Wall Street Journal, and they presented the standard kind of either or situation. All right. Consider the following cases. A middle-aged investment banker born in Colombia shows up at a physician's office in Manhattan. A laid-off middle-aged worker of Italian ancestry shows up at a doctor's office in Rochester, New York. Neither has medical risk factors, but both have mild to moderate symptoms of COVID-19. The wealthy Colombian American could be given Paxlovid, and the laid-off auto worker could be turned away, but they say would be in the article. And you can, according to these guys, and this is accurate, you can construct thousands of these comparative cases using well-off Hispanics, Asians, Blacks, and working class whites. I feel like we probably all on some level understand that this sounds unjust, unjust. I'm pretty sure it sparked a lawsuit from I want to say a Cornell professor. I'm going to kind of try to go into that too. That this kind of race-based issue should probably spark it should spark a lawsuit, right? Like this kind of decision making by our government should be a systems of checks and balances should be applied to it. But then I'm going to ask you guys a favor, like to indulge me for a second in some of my crazier conspiracy theories, guys, because like certainly I think we all agree, right, that if in fact diabetes is an accelerated risk factor for problems with COVID. And I think that we all kind of accept that is a reality, okay? That there are certain what are called comorbidities that deal with, getting sicker from COVID than other people. So it had been, and guys, I read a lot and I check out articles, and I have read articles. I have talked to actually a biochemistry professor that went to Harvard, a reasonably smart guy. I'm not going to mention his name on the show because I'm going to say something that I don't know if he wants to be responsible for, but I'm going to say that he found in some of his studies, and he pointed me towards the studies, and he pointed me towards data that might actually suggest, okay, that if you have a lot of pigment in your skin, that you can be, and guys, look, I don't like the way that New York State broke this down into race. Okay. But if in fact, and as your humanity, as you're a human being, right? As we want to talk about our COVID reality, if having a lot of pigment in your skin is a risk factor for having complications from COVID, it I think that would be okay. They're basically talking about basically a strategy for treating people with COVID, right? Like who gets early treatment, who doesn't. And I'm not sure. I'm sure that the supply we've seen where the supply has been messed with by the federal government, where the supply has been controlled by the federal government. We saw where Ron DeSantis went overseas to buy monoclonal antibodies for people in Florida, like all of those things happen. But is New York State, what I'm concerned about is that for too long we were politically sensitive, right? So we didn't want to tell the truth about certain aspects of COVID. And guys, this is just a theory. Maybe you could just say, like, all right, Tim's talking about the moon landing being fake again. Okay, let's just go down that road that way, and that's fine. So I'm just talking about a theory that I felt had validity, that was presented to me by somebody that I respect and that I did some research on. And that is, if you have a lot of pigment in your skin, and it could link to vitamin D, that vitamin D is harder for you to produce, that occasionally virus risk factors for people with darker pigment, more pigment in their skin, could be at a greater risk for complications from COVID. So if it wasn't a race-based strategy to, and New York State puts it right out. Let me see if I can find the comment. Okay. The language that New York State uses right there in the guidelines, that's to me the real problem. Okay. Simply being of non-white race or Hispanic and Latino ethnicity, which should be considered a risk factor, as long-standing systemic health and social inequities have contributed to an increased risk of severe illness and death from COVID-19. Now, whether that part is true, that the long-standing systemic health and social inequities have contributed to the increased risk, or it's very simply an issue of pigmentation and that is an increased risk of severe illness, or maybe it's not like, maybe pigmentation isn't even the right way to frame it. But if there is a real risk factor, and this is where I'm asking you guys to check your humanity, right? Like, fine, right? They get bumped up the protocol for treatment. And now look, your doctors, your hospitals, your nurses, they're going to do their best to try to make you healthy from COVID as fast as they can, especially if you do go to the hospital and need medical treatment. So no matter what, they're going to try to get you the appropriate treatment for your illness. That's what they do. That's who they are. I think that some of them are caught up in the government narrative, but I don't think that all of them are. And I'm sure that most of your doctors are not, right? Like that they just simply want you to be healthy. So guys, like think about it like this, right? Like the government says things so poorly, so nastily, and so like to buy votes from their special interest groups. Okay. But if in fact there is a real risk associated with COVID, if you're being non-white or a non-white race or Hispanic, Latino ethnicity, don't we as human beings, don't we just say that can't we just say it like that's okay? I mean, I don't know. There's some things that bother, everything about COVID bothers me, guys. You know that. I will say that this points that we've for too long not broken out real risk factors and made people really, really aware of their real risk factors. Like we finally are talking about obesity. We're finally talking about diabetes. It's been on the table for years, or for a year and a half, but people try to avoid it. And finally the CDC is coming through and saying, all right, people are dying from serious comorbidities. The count from COVID in the United States, guys, again, there's still all these problems, but I'm asking you to check your humanity and say, all right, the government miscommunicated on this. But if there is in fact a real comorbidity associated with these issues, not the systemic part. We don't have to worry about that, in my opinion, though we could talk about that, right? Does, you know, limited access to healthcare. Guys, we're coming up on a break. There's no way I'm going to talk about COVID for this whole show. I might do a few more minutes of it. But guys, once again, it is me, Tim O'Connor, coming at you on Thursday. Thanks again to WYSL and WACK. It's always much appreciated. I'll be right back after these messages. All right, bonus content for you, the internet viewer. Guys, thanks once again for joining me. Please leave a comment, leave a like, leave a share. If you guys got ideas for the show, definitely reach out to me on my Freedom Variant page. I'm definitely, there's lots of news. I'm going to be talking about Kathy Hochul's budget, and maybe she has a sense of humor, guys. I don't know. It was kind of a weird budget presentation. Maybe we'll go into Joe Biden and the Fed. I don't know. That one's going to give me a headache. But anyways, I'll be right back going live with the show. All right, welcome back to A Free Solution. This is Tim O'Connor, the Freedom Variant, your Thursday host, coming at you on the airways. Once again, it is January 20th, 2022, and we were just talking about an article, an opinion piece, and the New York State guidelines about who gets monoclonal antibodies and paxlovid. Paxlovid. All right. And how New York State put out the guidelines according to a risk factor of being non-white or Hispanic. And I think that the case could be made that there are risk factors associated with income, associated with all sorts of things. Okay. But I think that you guys probably agree that as a humanity check, if there is something of being a non-white race or a Hispanic Latino ethnicity, that we should consider, the risk associated with that. But to frame it under the systemic health and social inequities framework, the social justice warrior, the woke patrol, I don't think that that's the best way to present the case. These guys make the case, and I've made this case to you guys before, that there are not enough details about what's going on. Like if you break some of this information up into race, ethnicity, age and gender, vaccination status, and things like that, when we're talking about racial disparities, it's uncontrolled for economic class factors. There is a lot of information available, and I don't ever feel like that information has been correctly or appropriately communicated by the government when it comes to COVID. I do think that we did let political correctness stand in the way, and so how do we fix that in New York State? And I don't know. When we talk about guys like Larry Sharp running for office, and again, Thomas Daniel Queter running for office, I think that we have an opportunity in New York State to take a hard look at our realities of how the government and the media participate in manipulating us. And guys, that's also a common theme. But to pivot away from COVID for a little bit, Kathy Hochul has announced her new budget. And guys, I'm thinking she may have kind of a sense of humor. I don't know. She did a little 13-minute speech. We'll talk about the budget. We'll talk about her speech, and we'll go from there. So, guys, I proposed $216 billion state budget Tuesday. It's going to provide bonus payments for healthcare workers, bolster funding for schools, and guys, this is the absolute most important, casinos in New York City. All right, like as if the casinos in upstate New York aren't good enough. What New York City needs is casinos. All right. So the state uh, amazingly enough, financially is not in that bad a shape, at least in part to the amazing amount of spending that the federal government has thrown at all of the states, but especially states like New York. So there's this large influx of federal aid, stronger than expected tax revenue, but it was still down. Okay. So it left New York with a projected $5 billion surplus, which guys is imaginary. We're like 15-16 billion dollars in debt every year, 50-60 billion dollars in the hole. It's interesting that they can put a spin on it that says that we have a surplus when we're carrying debt for decades and it no end in sight. But Kathy Hochul said this is a once in a generation opportunity to make thoughtful, purpose-driven investments in our state and in our people that will pay dividends for decades. And she says that's exactly what her budget's going to do. She did decline to replenish funds, at least at this time. This budget, as you guys probably know, goes to the Assembly and the Senate, and they do some negotiating on it. But she declined, at least at this point, to replenish funds for parastate run programs that are essentially out of money. The Excluded Workers Fund, which provided grants to undocumented immigrants who are ineligible for unemployment benefits. So if they get fired, they don't get unemployment. I think we could do a show on how immigrants, even legal immigrants, documented immigrants, are in a very quasi legal stance that I think should be improved, even on the federal level. That has nothing to do with illegal immigration and encouraging it. That has nothing to do with refugee programs. It's a whole different issue where visa 2A agricultural guys can come to our country, work hard on some guy's farm, get fired, and all of a sudden be an illegal alien. And I don't, because there is inequity in our system when it comes to things like that. People get jobs here. They do sneak into the country, and that I know a lot of people are uncomfortable with. I'm uncomfortable with that. I do wish that there was a better control for it. I do think that there should be a better control for it. One of those issues that has been reserved for decades. I can remember people fighting about it in the 70s, and they keep not fixing it in any way that is acceptable so that they can keep fighting over it and they can keep dividing us over it. And that's one of the biggest issues about immigration that I would fix, is that we could come up with a saner immigration policy. We could treat people better that come here. We could still participate in refugee programs where people that are at risk or victims of war can come here, and we can be happy about that. Okay. But what we do with immigration is we use it as a whip, something to keep us divided, and that really bothers me. All right, but then so I digress, right? Let's circle back around to Kathy Hochul and her budget, because she did in her little speech today about the budget. Because I just want you to know she is going to fix the roads, and as a libertarian, I could not be less excited, but technically I'm very excited, and I think her plan is hilarious. I honestly think she might have a sense of humor, guys. I'm not sure, but she has dedicated $1 billion to pave our potholes. That's right. The POP program. I'm not kidding you. Okay. $1 billion to pave our potholes. New York State is going to be under the guidance, the kind tutelage of Kathy Hochul, pothole free. I can just envision, guys, like a 1-800 number where you call in and you say, look, there's a pothole on my street. She dispatches a state agency, the emergency pothole repair crew comes to your house and fixes the pothole. Guys, $1 billion is to repair potholes in New York State. 1 billion of the $5 billion surplus, or the $216 billion state budget. That's right. Kathy is going to save you from potholes. And guys, I don't know, the POP plan. I mean, I'm not making this up. She said it. I don't. Wonderful. As a libertarian, man, we spend so much energy and money arguing over roads. I'm just like, yeah, if we didn't waste all this energy on it, we'd have flying cars and, air trains that go 250 miles an hour. I swear to God, but whatever. So the POP plan, guys, the roads are going to get fixed. So the other program that she decided not to fund is the Emergency Rental Assistance Program, which covered up to 15 months of back rent for those financially harmed by the COVID-19 pandemic. I'm not sure that should have been done in the first place. Most people were getting lots of money and they took advantage of this situation. And we hurt one of the best side hustles used to be one of the best side hustles, right? Small property owners who wanted to rent their place out. Okay. So the government's not going to pay people's rent anymore in New York State for those financially harmed by the COVID-19 pandemic. I don't even know, I never got to where I could ask for that money. So anyway, I wouldn't know what it would entail. But I do know that people weren't getting evicted. People were unable to be evicted in New York State. And that created a lot of problems for small landlords, the small business, small side hustle. No one cared about that. So we've got to change. I believe we have to finish changing the New York State Constitution. But I believe that now in 2022, we are going to have casinos in New York City. The mob is no longer going to have a monopoly on gambling in New York City. Well, the mob in New York State selling lottery tickets. But anyway, I guess in a way, as being a freedom-based kind of guy, like, okay, have casinos wherever you want. That's fine. Oh, hey guys, did you see how finally FanDuel has made New York State? FanDuel and DraftKings and all of those, whatever you call them, little massive gambling outfits. So you too can gamble on your football teams right on the internet. I wonder who lobbied for that and what kind of rules they had to make. Interestingly enough, right? So anyways, big boost coming to education spending. And guys, we'll go more into this budget in a few minutes when we come back from break. Once again, it's Tim O'Connor, the Freedom Variant, and I'll be right back. Welcome back to A Free Solution. It's me, Tim O'Connor, your Thursday host for A Free Solution. Hey guys, don't forget to check out Larry. He does Tuesdays. Larry Sharp, the man, the myth, the legend, the guy that is running for governor of New York State as a libertarian, does the show for you on Tuesdays. Kevin Wilson does it Mondays and Wednesdays. Kevin and I share the stage on Fridays. And guys, Fridays, I think we just basically try to have fun. All right. We basically go over some news. We basically talk about a few things. We've had some in-depth conversations, and so I hope that you check out our show. Sometimes we do call in, sometimes we do it live, and we cover questions with people. So please check out A Free Solution and Kevin Wilson and I for Friday Free for All, Friday Fake News Friday, and let's have some fun. So before the break, we were talking about the state of New York State and the budget. Guys, $1 billion to pave our potholes, man. I just think that is epic. All right. So $10 billion plan over multiple years to improve healthcare facilities and bolster the state's beleaguered healthcare workforce, which was struggling to maintain adequate levels even before the COVID-19 pandemic. What? Where did you guys hear? Who have you guys heard talk about the reality that there was a human infrastructure problem in the healthcare industry? And not to top that off, mandated vaccines cost us human infrastructure and it costs us services, guys. It costs us serious services, and it's causing the uptake in COVID problems to be exacerbated because there's not enough people. So we're getting federal help and we're calling up the National Guard, and we're doing things like taking National Guard healthcare professionals away from their healthcare job to serve as the National Guard healthcare professionals. So what we're doing to them is unfair, because if we maintain our levels of National Guard after this kind of dystopian response to COVID, I will frankly be amazed. Okay. So to continue down the road of not innovating, but throwing money at a situation, record, guys, record $31 billion of state aid going to the schools. Now, as you know, I'm fond of my teacher friends. I think many of them are in an incredibly awkward situation where they don't really buy the hype. They're not dedicated unionists. They're not dedicated to politics. They're dedicated to teaching your children things like history and math and English. Okay. They're dedicated to that. And they don't really have a political agenda other than some of them have political agendas, don't get me wrong. But for the most part, they like their jobs. They don't participate in politics. They do their jobs, and they're seeing problems with the way we are treating our children right now. Okay. In schools. And guys, you've heard me talk about it. I mean, I get so repetitive, but it's important that we talk about things that like look more like the science of compliance than anything like real science. Okay. And so what we're seeing going on in schools, kids not really at risk from this stuff, that being forced or encouraged or berated and beleaguered into taking vaccines and playing sports in masks and maintaining distances and keeping their masks on all day and taking the occasional mask break to eat and stuff like that. Guys, we're torturing our kids, man. And that's got that. I want that to go away. I want that to stop. I think that I know people that are pulling their children out of school, that have pulled their children out of school, that are considering pulling their children out of school, and that people are leaving the state. Okay. When you can go to Pennsylvania and no kids are wearing masks when they're playing sports, unless they want to, there's no rules about it, guys. Like, what's different in Pennsylvania than in New York? What's different? The authoritarian response to COVID is different. That's it. It's not less serious in Pennsylvania. We don't seem to be controlling the spread, though. Finally, the numbers are peaking and going down. Then that's always good news. But what did the government do to make that happen? And then if what they didn't make the numbers go down, or if it did, what did we do? Did we just prolong the notion that like you're just going to get COVID next week instead of this week because you wore a mask into the convenience store? Like, I get it, man. We started out flattening the curve, but now the curve unflattened itself, regardless of the steps that the government took. It's time for us to admit the reality, all right, and move forward. Freedom and responsibility, and understanding your comorbidities, and understanding who you are and what your risks are from these things. Those things are incredibly important. That's also why there's no reason to beat up on kids with this anymore. Okay. Anyways, so $31 billion. We are going to throw money at education. We're not going to, it doesn't sound like we're in, I didn't hear one word about innovating education. I didn't hear one word about great ideas that are working all over the country that people are moving towards, like the money, the education money following the student so that in your densely populated urban areas, the better schools are going to make more money because they're going to have more students, and it brings an element of competition to the school system, especially in urban areas. Guys, like, look, I live in rural New York. I know my kids' teachers. I like most of my kids' teachers. Heck, I know most of, or a pretty decent number of administrators at the school. They're all good people, man. They want the best thing. They buy into a narrative that some of the, especially in the administration, buy into this narrative of we're saving the world by making the kids wear masks, even though my kids tell me, like, there's whatever. I don't want to get anybody in trouble, but there's some flexibility as to the mask wearing, depending on what's going on and who's watching you. Let's put it that way. Okay. And that, I'm sure we all know that. I'm sure we all understand that that's probably a reality. Okay. So $31 billion with no innovation. And guys, we could pretend that New York State's some sort of education powerhouse in as far as the grade school and high school teaching goes, but we're not. Okay. You can check my receipts on that one, man. We're like 17th in the country, and we're number 1 or number 2 in per student spending. Okay. And no matter what, like right now, we don't have enough bus drivers. So that's really the issue. People have fled New York State. So whatever. We're going over the budget. Circle back around. $31 billion, 7% higher than the last fiscal year. And guys, no matter what, like, higher budgets, higher aid eventually lead to higher taxes. Okay. So, okay, no one wants to accept that other than crazy libertarians, some conservatives, and a few liberals out there will understand that higher budgets lead to higher taxes. It's inevitable. But okay, so we chase more people away with authoritarian dictates and higher taxes. Great. $53 million to each of the SUNY and CUNY higher education systems to hire more faculty. The money would allow SUNY to hire 340 staff, faculty members, guys. So they're also a big, huge budget for healthcare workers, included in there, $1.2 billion to provide frontline healthcare workers with state-funded retention bonuses. Those who stay in their job for a year will be eligible for bonuses of up to $3,000 from New York State. Guys, we're coming up on another break. I kind of been missing on the time. I've got to hit it this time. But it is Tim O'Connor, the Freedom Variant. We were talking about the budget in New York State. We talked a little bit about COVID and how that relates to the budget. We've got one more segment. I hope you guys hang in there with me. We'll be right back after these messages. All right. Once again, it's me, Tim O'Connor, the Freedom Variant, coming at you on WYSL and WACK. Guys, once again, we were just talking about the budget. But before we go into that, I once again want to thank WYSL and WACK for offering me, the Freedom Variant, a platform to talk about libertarian politics. Yeah, we try to step outside of the conservative narrative. We try to step outside of the liberal narrative. We try to step outside of the Democratic narrative. We try to step outside of the Republican narrative. And I think that if you listen and participate in these shows and you ask your questions and you really are concerned about the way that the state is heading and about what I call an authoritarian spiral, where we're talking about, people are still talking about Donald Trump, and I get it, man. And people are talking about Joe Biden, and I get it. But what they've convinced us of is that somehow they're more important than your local politics, than your state politics, and that the authoritarians that promise to protect you are the solution. And guys, that to me doesn't quite line up with our experiential reality. So we were basically, I was basically breaking down the budget. And I just again want to point out that the pop program, man, $1 billion for to pave our potholes. It's witty, okay? I mean, it's witty, it's kind of funny. And this lady, she has $21 million to campaign with. Bill de Blasio. And guys, I'm really glad about this. Because I just can't stand the guy, but Bill de Blasio has withdrawn from the race. So right now it's Letitia James and Kathy Hochul. And I think that before long, it's just going to be Kathy Hochul. Like, that's it. She's been, the Democratic Party has anointed her. She is going to be the gubernatorial candidate for the Democratic Party. She has the power to write the budget. She's done a lot of things that are in the budget that going to buy a lot of votes, right? Even refunding, I want to say, make sure I say it right, it's not refunding the property star tax rebate that ran out of money in 2019 or expired. So basically, you guys are going to we're going to get a few $100s back again off of our property taxes in your state, which is weird to me. Just cut property taxes and leave them that way. That way we don't have to be, who knows what it costs to print these checks. But again, right, there's a certain amount of this that politicians want their names on checks, and they love to get their names on checks directly to you. Even, Donald Trump did it with stimulus checks. Joe Biden did it with stimulus checks. These things are real. Okay. So star rebate. And guys, at the end of her little news conference, Kathy Hochul said, "This budget's for you." Like, I don't know if you guys go back to the 80s and the Budweiser Real American Heroes, and this bud's for you. So anyways, she is going to use the budget to fix the healthcare industry that was already broken, and she broke even more by continuing down the authoritarian spiral. Whatever, guys, I don't know. It is at this point what it is. I think that, again, I'd like to point out that we have an opportunity to make some drastic changes in New York State. And again, you guys can listen to Larry yourself on Tuesdays on The Free Solution, which is available not just on WYSL and WACK, but on our Facebook pages on The Free Solution, at the Free Solution group page. It's available on the Twitter. It's available on YouTube. So guys, please check it out. Take the time. Engage us in conversation. I think Larry does a great job answering questions. Kevin does a great job answering questions. I do a great job of having conversations. And guys, I've got lots of shows planned, but if you have something on your mind that you would like to talk about, let me know. And I guess one of my issues that I haven't done enough of on this show is shared parenting, and how New York State's basically drastically behind the curve. And I have shows coming up about that we can do a better job as human beings sharing our children with people that were significant in our lives. Okay, that children need a dad, children need a mom. You can talk about gender roles however you want. It doesn't matter. Children need both parents. They're a product of both parents. It's an important thing, and I've got ideas about how to talk about that more and more effectively in the future. So stay tuned for more free solutions from Tim O'Connor. And number one, a road to shared custody is a presumption of shared custody, a rebuttable presumption of shared custody in New York State. And there is always bills on the floor. So guys, Assemblyman Chris Teague, he has one. Reach out to him. Let him know it's important. Larry Sharp, if he gets elected, we will really be having this conversation about a better way forward. But guys, so check this out, man. People have been reaching out to me like crazy because of the purported wood burning ban in New York State. And if you use wood in New York State, you're actually going to want to listen to what I have to say. I know people with outdoor wood boilers. As a matter of fact, my mom has one. And let me just tell you that those have already been limited in New York State. Okay. There's basically no outdoor wood burning boiler dealers, which is actually, if you think about it, a great way to use wood. You heat your water, you use that water to then heat your house, just like your boiler in your house, except for it's outside of your house. You set it up away from your house and you burn wood, and you burn a lot of wood, and people enjoy it. People enjoy burning wood. That's something else, guys. But there's this big, huge rumor going around that we're going to be banning wood burning to heat your house. And like I said, we've already disrupted the possibility of you having a wood boiler. You basically have to have your own little compound that has to be set up really far away from your neighbors. And guys, you can't even get parts for these things in New York State. You have to go to the manufacturer, order the parts in. So there has been legislative action in New York State to limit use of wood to heat your house. Now, as I understand it, and because I don't know, sometimes when I read these things, it sounds like, all right, we're gonna ban wood. All right, okay, but that comes across as an interpretation of a law. Written into New York State law is a plan to reduce wood consumption by 40%. Now, the plan to do that, what they're basically saying is it's an equivocation. They're not banning wood consumption. The plan to do that is with more efficient wood burning stoves, as well as increasing electrification of primary heating across all fuel types over time. Now, I think that, again, being a rural American, I see problems with the notion of increasing electrification. We already have problems in the summer when people are requiring an increased demand, right? And we're seeing, guys, the government's forcing this issue, which should make people paranoid, does make people paranoid, and definitely makes people angry. They're not allowing natural gas hookups in new building in New York City. Now they're going to say we're going to reduce wood consumption by 40%. Let me tell you something about wood, okay, guys? I live in rural upstate New York, okay? Wood is everywhere. A lot of people own a few acres, like wood is free, okay? Wood is not free, okay? It's not free for everybody, but it's free for a lot of people, and it's a hobby for a lot of people, and it's a way to stay healthy for a lot of people. It's rigorous physical exercise to get your wood, stack it, split it, cut it. Okay, so it's rigorous physical exercise that you trade off for, number one, your health. Number two, because if you do the dollars and cents of it, okay, you're not making money by burning wood. I don't care what anybody says. Some people claim, and one of my friends, he's a doctor, he's smart, he saves a lot of money on his oil bill, so he's using wood. Because wood is freaking everywhere. Trees blow down onto the ground all the time. A lot of them are hardwoods, and a lot of them are really effective ways to heat your house. To even to the goal of reducing it basically is going to force it into like high efficiency pellet stoves and high efficiency wood burning. And they make the case that wood smoke is bad for asthma and stuff like that. Okay, maybe that's true. I don't know. It doesn't seem to be around here. I could see where in a densely populated area that it would be a slightly different experience than it is around here. But I mean, I'm a big fan. I tease my friends that burn wood a lot, and I say, look, it's a part-time job that does not pay very well, but you do you, man. It's not necessarily the issue, right? There are trade-offs. It is a health thing. It is a great way to clean up your own land. You say you got 10, 15 acres and most of it's wooded, you will have enough wood Based on what I've seen, you will have enough wood. You'll be able to harvest your own wood. You'll be able to get deadfall wood off of 15 acres of land that will heat your house every year. Okay. Like that's without even going crazy. And you get rid of a tree or two. And then I mean, wood is an effective, efficient way to manage your own property. People like to be in touch with nature. But okay, so is wood burning actually going to be banned in New York State? No. Are they going to force you to buy more efficient wood stoves? If you want to burn wood, are you going to be forced into the pelletized wood range? Those things are probably true. Okay. So, not probably true. Those things are true, right? And who knows what the long-term ramifications of the Clean Air Act that passed in New York State is going to be. It could eventually lead to the banning of wood. But right now, we're going to reduce wood consumption by 40%, and that's to electric, that's to more efficient stoves. Guys, it's Tim O'Connor. I am the Freedom Variant. Please like my Facebook page. Please leave comments, questions. Have a great weekend. Check out Kevin and I tomorrow. Thank you very much.